how I use blocking techniques to achieve reductions. I'm going to talk about two fractures. First one's going to be the proximal fracture, and then we're going to move on to the distal end of the tibia. So these need something additional. You cannot just nail these. You've got to do something to address the mechanics which are leading to this mal-reduced position. The nail will not do it, so don't start nailing this, don't start putting things into this until you've got that plan in your head. This is Pete's paper from the JTO, so I stole this and didn't tell him, but now I've told him. This is a very good way to use locking screws, to blocking screws, to try and recreate a cortex that will help you to reduce this fracture. So the blocking screws are put in before you make any tracks through, ideally, and that's the way to do it. These are difficult, so if you're going to use blocking screws, probably this fracture is not the one to start with. There are other fractures which you can use blocking screws on to start with. However, even with that, these are technically difficult, and it's a three-plane blocking technique, and you've got to be aware that you can't just operate off the coronal plane on these fractures, or you will still get burned. Equally, you can't just operate off the sagittal planes. Pete Hull has gone on to say where you place the screws and how you use that placement in the acute angle of the fractures to get that translational force and reduce your fracture. Looks good in simple diagrams, but again, it requires probably just practicing something a little less technically difficult than that. But what you don't want to end up with is this. I go a slightly different way, and this is still a blocking technique, and one that we're all familiar with, which is a 3.5 plate. And this is extremely simple, extremely easy to do, and generally I use a very small incision over the same as we would use to retrieve a plate from a percutaneous plateau fracture, short incision, just lateral to the crest of the tibia, so long as the fracture allows, and then a little plate, often with just 2 screws or 4 screws, all anterior, so the nail will always go behind this because you're in that really thick bone. Having got this reduction is then a very, very straightforward fracture. So you've taken a complex situation, used a little adjuvant plate to make it into a very simple situation that we can all deal with, and that's robust, and that's what I tend to do. Moving to the other end, we will all see these fractures. The next tibia that comes in, it's much more likely to be a distal end, spiral-type fracture than that proximal fracture. And we'll see these increasingly commonly. So this is something everyone has to do with. And again, you have to use some kind of blocking technique in this situation, or you will get a malreduction, and that will haunt you or haunt the guy who has to do the reconstruction following you. Typically, we talk about blocking screws. You don't have to use a screw. You can use a Shantz pin. This is a 3mm Shantz pin. Bob Hanley favors using the Shantz pin. This will give you a handle with which you can maneuver the distal fragment. I like to use the guide wire, and what I use is the entry guide wire from my nailing set. So I'll get my entry point at the proximal end, which will be in exactly where I need it. Then I will use that entry guide wire to act as a blocking wire. If you're not happy just using a smooth tip wire, you can use a threaded wire, which is slightly more hold. Whichever wire you use, you put the T-handle on it when you ream past, because otherwise you can drive it right through the tibia. Where do I place it? Again, stealing from Pete Hull, in the acute angle, which now lateralizes in this situation, because it's required, lateralizes the cortex, and I'm using that as the buttress and reduction tool to achieve the final position. Blocking screws block. That's what they do, and this is something you'll see. What I've tried to stylize in this diagram is the nail going down, and we've all been here, we've tried to use them. The blocking wire is still in the perfect position, but the nail won't go past. It's why I favor using smooth wires, because then again, that helps me to glide the nail past. But also what I do commonly in this situation is I impact the distal tip of the bent wire into the metaphyseal bone. I then turn it, and you can see in the middle portion of this, I've turned it through 180 degrees, and because the tip is fixed, it causes a translation of the wire. So it translates medially, in this case, the wire as it passes the screw, which helps you to get that nail past the screw, reducing the fracture. And the situation you end up with is this. So those are the techniques that I would favor as blocking techniques. Both are very robust. One uses a very small plate from the small fragment set, which we're all very familiar with and happy to use. The other reuses the wire from your entry point, which is big enough. It does bend a little bit, but it's strong enough to give you the force you require without too much additional trauma. Thank you.